Hi, everyone. Welcome. My name is Lucy Schiffman, and I'm the Senior Manager of Community Engagement with the Myotonic Dystrophy Foundation. I'm so excited to welcome you to our Myotonic Dystrophy in Motion Awareness Month, Movement Monday, focused on balance and fall prevention. This is our second program of the month, and we're really excited to have all of you join us. Before I begin, I want to share a little bit about the Myotonic Dystrophy Foundation. Our vision is to envision a world with treatments and a cure for myotonic dystrophy. Our mission is made up of three parts: community, care, and a cure. We support and connect the myotonic dystrophy community. We provide resources and advocate for care, and we accelerate research towards treatments and a cure. We have many resources and support programs that you can utilize at home. Our toolkits and publications are a great resource for you and to share with your doctors and clinicians. We have a resource just for exercising, the exercise guide for people living with myotonic dystrophy, a DM and the Heart Community Guide, anesthesia guidelines, the MDF toolkit, and our mental health guide, plus many, many more, including clinical care recommendations and resources for clinicians and researchers, including grant funding opportunities for DM research. Online, you can find information about our support programs where we have trained community volunteers leading support groups every week that are safe spaces to network, learn, and share. You can also find our digital academy where you can view hours of educational and inspirational videos by DM experts on demand. And of course, our calendar of events to see what else you can join in the community. Find all of these resources and more at www.myotonic.org. We want you to stay in touch. And you can do that in a variety of ways. You can follow us on social media, Instagram, X, Facebook, or LinkedIn, and you can sign up for emails and our monthly dispatch at www.myotonic.org/sign-up. Speaking of upcoming events, I want to highlight some things that are happening. Of course, throughout all of July, we have our Movement Mondays. This is the second of 4 Movement Mondays. So keep joining us each Monday at 7 p.m. Eastern, 4 p.m. Pacific. When each of these events will be followed by a movement and meeting happy hour where you can connect with other DM community members and talk about your movement habits and experiences and what brings you joy while doing your exercises. We also have a special Stump the Doctor movement webinar next Wednesday, the 23rd at 7 p.m. Eastern, 4 p.m. Pacific. In addition to our In Motion Awareness Month, we have our Ask the Expert webinars where each month we'll be hosting different webinars where you have access to talk to experts about different topics. In July, we have Seeing DM Clearly. In August, it's genetics and myotonic dystrophy. And in September, we'll have pediatric endocrinology. Once you register for the Ask the Expert series, you don't have to register again. You'll be registered for all of the webinars, similar to In Motion Month. If you're interested in continuing to move all year, I really encourage you to buy a limited edition Myotonic Dystrophy in Motion Awareness t-shirt. That's special for this year. And you can also buy MDF branded exercise gear. All of these are available at myotonic.org/in-motion. These are only available through July, so order them now while you still can. I do want to take a moment to thank our movement committee, who is a group of experts as well as community members dedicated to supporting getting the DM community moving and active, and who were instrumental in planning our In Motion Awareness Month and all of these programs for you. We also want to thank our Myotonic Dystrophy In Motion Awareness Month sponsors, Avidity Biosciences, for supporting this series of programs. Thank you all for joining us. We may have the opportunity to ask questions. You can see on the bottom of your webinar screen or the top, there is a Q&A button and you could submit your questions. If we have time at the end, we will answer a couple questions. And if not, we will pass your questions on to our Stump the Doctor panel, who will be joining us next Wednesday on the 23rd. And so without further ado, I would love to introduce our expert for the evening, Dr. Katy Eichinger. Dr. Katy Eichinger is involved in the clinical care of adult and pediatric patients with neuromuscular diseases. Additionally, she is part of the neuromuscular research team and is involved in natural history studies and clinical trials for patients with Duchenne muscular dystrophy, Charcot-Marie tooth disease, and myotonic dystrophy. Her interests are in outcome measures, health and wellness, and balance. She's been involved with clinical evaluator training and assisted in preparing the manual for the pediatric assessment for the CMT natural history studies. Her interests are in outcome measures, health, wellness, and balance. So without further ado, I will pass it off to Dr. Katy Eichinger.
Hi there. Thank you so much for joining tonight. Really appreciate it. I hope you find this time informative and helpful, and we'll go ahead and kind of get started. So my goals for tonight are to give a little bit of an overview of balance physiology, and then talk about the deficits or that some people may have with the balance challenges that some people may have with myotonic dystrophy, and what factors contribute to these balance issues. And then also talk a little bit about training and physical therapy for balance challenges, and then hopefully end with a little bit of a movement moment where we can practice some of the things that we'll talk about. Go ahead, next slide. So overall, just the general question, what is balance? So balance, as you can see this woman standing here on a rock on one foot with not touching anything. What it is the ability to maintain our center of mass over our base of support. So when we think about our center of mass, I want you to think about basically a point in your body, which is about kind of between your belly button and your back, and it's really kind of at the level of your low back. And so that's really what we consider the center of mass of our body. If you think sometimes when women are pregnant, their center of mass changes because of the extra weight that they're carrying in forward, or when older people may have some postural changes. Again, that can naturally shift where our center of mass is. But for the most part, it's located kind of in that low back area. And when I say it's the ability to maintain the center of mass within the base of support, well, your support for both of us standing, or for all of us standing on both feet, is really just kind of keeping that grounded right over our feet. Now, if you can see this woman standing here in the picture, she now only has one foot as her base of support, and so it's a lot narrower, and her center of gravity has to shift with that. And so what happens when we think about our balance being challenged is sometimes our base of our center of mass is moving within our base of support, or kind of at the edges of our base of support. And that makes us feel a little bit more unsteady, because we're having to kind of work to keep our center of mass within that base of support. If that center of mass goes outside of the base of support, you have to recover your balance and bring it back to the center piece there. So that's kind of when we're talking about balance, that's what we're thinking about. And then go ahead, next slide. The things that we want to think about in terms of how does balance work is that we have information coming in from our environment. Then information comes in from all of our different sensory systems. Our vision, so we get a lot of information coming in through our eyes. We also get a lot of information coming in from our vestibular system, which is in your inner ear, and it senses head movement. So it senses your movement going back and forth and turning your head. All of that is information from your vestibular system. And then we have our somatosensory system. So the somatosensory system is your muscles and a lot of these tiny little organs that tell our body what our muscles are doing, how our feet are feeling the ground. It's just your overall kind of sensory system from your body. And all of that information comes into your brain. Your brain compares the information from the different systems and then sends a message back out to your muscles and tells your muscles how to correct your position in space so that you stay upright, so you maintain that center of mass over your base of support. We also need to have, when those messages go back out to our muscles, we need to have adequate range of motion and adequate strength for those muscles to do the job that the brain is telling them to do. So it's kind of all the information coming in, gets compared in the brain, and then sends messages back out to make those postural adjustments. So go ahead and, next slide. So just to give you an example, if I'm standing here and I start to lean forward, like I start, having a little bit of a balance loss, my environment gets closer in my face, so I know that my vision is telling me I'm moving forward. My head translates forward because the vestibular system senses me moving forward. And then my weight shifts and it's now on the balls of my feet. And my brain gets all this information of, okay, you're falling forward, you're falling forward. The information comes into the brain and then the brain sends messages back up to the muscles and I push down with my feet and I stand back up. And so that's just kind of how this all works in real time. And you can imagine it works very quickly. But there are places that this can fall apart. When I talk about reactions to bounce, and that's the next slide, we have these different strategies. So very small movements require our ankle strategy. A little bit bigger perturbations, we start to use our hips. And then if somebody comes from behind and knocks you right off balance, you end up taking a couple of steps to be able to catch up and get your center of gravity back in within your base of support. And as the challenges get greater, we move from an ankle strategy to a stepping strategy. The other thing that happens is if our muscles at our ankles, which again, this is something within myotonic dystrophy, if those muscles aren't working 100%, then we have to turn to hip strategies because we can't use the ankle strategy. You're good. Next slide. And so there are several different things that contribute to instability and falls in the general population. And we kind of break them up into intrinsic things, so things within our body, and extrinsic things that happen outside of our body. So when we think about intrinsic factors, it's our strength, our sensation, our confidence. Confidence is a really big really big part of our stability and our ability to move around our environment. Our cognition can also play a role in intrinsic factors. Medications, so certain medications can make those balance systems work not as effectively. And then sometimes people have blood pressure problems, and those can contribute to falls. And then when we think about extrinsic here, I live up in the Northeast, so we think about, like, in the wintertime, I'll ask individuals if they've had a fall in the last few months, and they'll say, yes, I slipped on the ice. And while that is not a good situation, it is a fairly common situation for people who do or do not have other underlying medical conditions. The other medical conditions can make it a little bit more challenging to recover balance versus somebody who has all of their balance systems working properly. Really important to have good lighting. So light can affect our extrinsic balance because it can impede how the vision is working. Clothing and footwear. So, thinking about wearing high-heeled shoes versus sneakers, you can imagine how that changes your balance. Uneven ground, so walking up and down stairs or on grass, things like that. Again, that's your environment. And unfortunately, our little furry friends can also get in our way and create a tripping hazard or a reason for a fall. Next slide. So what do we know about balance deficits in people with myotonic dystrophy? So in the early 2000s, Wiles put out probably one of the first papers that looked at this specifically in myotonic dystrophy and noted that there's an increase in stumbles and falls and increased risk for falling for people with myotonic dystrophy. And it was for kind of one of the first descriptive papers. And then more recently, we have a couple of different things that, again, just kind of describe what the prevalence is of falling in myotonic dystrophy. So Scarano talked about 8 out of 16 fell in the past 6 months, so that's like 50%. 5 out of 16 were frequent fallers, so more than one fall in the past, however many months. I looked at in a survey and then a prospective study, I had 33 out of 48, so even greater than 50% fall in the past 6 months. And then around just under 50% fell more than once in that time period. I think the most striking thing that I found was that 12 individuals had an injury and there were 5 fractures. So the downside is when people have balance deficits, the consequences can be great. Those falls can lead to decreased balance confidence. So then you become worried that you're going to fall. Obviously, resulting in an injury can really affect a person's quality of life. So the consequences of having balance deficits as well as falls can really, really lead to great consequences. So when we think about balance, so I talked about balance physiology for overall general population, kind of how it all works. And then when we think about it in terms of people with myotonic dystrophy, there are places along those pathways that may have more challenges. So when we think about sensory information, people may have decreased proprioceptive. So that's kind of your body awareness information coming in. There are people that have vestibular. I wouldn't even say it's truly just impairment, but sometimes when we don't use our vestibular system is the system that gets stimulated a lot when we ride on roller coasters or amusement park rides. And in individuals with myotonic dystrophy, where there may be some neck weakness or other things, you may tend to not use your head as much, and therefore our vestibular system doesn't get activated as much. And it doesn't function quite as much because you don't call on it to function. So it's almost kind of a disuse impairment. And then vision can be impaired because of cataracts. And so that's all of the information coming into the brain that can be affected. And then we have challenges in our central nervous system. So fatigue can be a significant factor in how our brain works. And just the neural connections, the way the brain talks to each other can be a little bit more slow and doesn't make decisions as quickly. And then thinking about the messages going back out to the body, like I said earlier, range of motion, muscle weakness around the ankles, so that ankle strategy is impaired, and then overall leg weakness or trunk weakness doesn't allow those muscles to all contract at the times that they need to maintain that, again, thinking about keeping the center of mass over the base of support. Okay, so those are the pathways in which people with myotonic dystrophy have places where the pathways don't work quite as well, and we end up with feeling unstable or feeling like our balance isn't quite as good. But there are things that we can do about it. And I guess that's probably the great thing, is that there are things that we can do to improve balance. And those things, if you want to go to the next slide, are things in terms of exercise. There are lots of different ways that we can get those muscles working. So using resistive strength training strategies are important because it gets the muscles to be as strong as they possibly can. But it also helps because when we exercise, we make the brain talk to the muscles. And so then the brain is ready to talk to the muscles. And so even if the muscles aren't super strong or can't become stronger, it's still really important for that brain muscle connection to be as strong as it can be. And that means that our muscles will kick in quicker and be able to respond better. So that's the role of strength training and resistive training. Like I talked about range of motion. So when we talk about ankle strategy, having the amount of the most flexible ankles can help, because now you can use your ankles to help maintain your balance, because that's that little bit of sway that happens around the ankles. So having good range of motion is important. And then something that we talk about as well as far as treatment is really kind of practicing how all those systems work together. And that's what it's called in our field multisensory balance training. So that is teaching the brain how to work, and I'll talk a little bit more about it, and effectively use all of the different pieces of information coming into the brain to help strengthen those systems. So then, overall physical activity and exercise, you're moving as much as you can, you're keeping your vestibular system strong, you're keeping your muscles strong, you're keeping everything stretched out. So physical activity and exercise are super important as well. Next slide. So in general, I think Tina probably talked about it, I'm talking about it, we all talk about it quite a bit, is that it's important to be active. And these are the overall physical activity recommendations. So we're looking at 2 hours and 30 minutes of exercise a week. So that's 5 days of 30 minutes or any combination thereof. You want to do muscle strength training, resistive training, involving all of your major muscle groups. And then really, I think that the key point of the guidelines for people with myotonic dystrophy is that the recommendation is to follow these guidelines. And if it's not possible due to your muscle weakness or your myotonic dystrophy symptoms, that you still need to be as active as you possibly can and really avoid inactivity. So that's my spiel on making sure you're staying active, because that really helps with balance. And then next slide, I talked a little bit about flexibility and the ability of your ankles to be able to move. But we need that range of motion to be able to make those postural adjustments. So if you think about the hip strategy, the ankle strategy, the stepping strategy, we need to be able to have range of motion to adequately do that. We can look at doing things like other types of range of motion that work on posture. Again, we talked about at the very beginning how I talked about how posture can affect where your center of mass is. And if you have poor posture and your center of mass moves, then everything, becomes, now it's sitting on the edge of your base of support, and we want to bring it back. So we want to do things that improve posture. And again, flexibility and range of motion activities can also improve how the muscles work together. And one couple good ways of doing maintaining this flexibility and this muscle coordination is considering activities such as yoga or Tai Chi, because they're looking at stability, they're looking at range of motion, they're looking at how the muscles coordinate together, and really have been shown in the literature to improve balance and coordination in all sorts of populations. Next slide. And I talked just a little bit ago about multisensory balance training. And again, this is where we have our 3 balance systems: vision, vestibular, and somatosensory. They're taking the information in from the environment. But what we can do is we can train so that the different systems have to work better and work together better. So for example, doing things where your eyes are closed or eyes are open, standing on different surfaces. So whether you're not standing on just level ground or standing on sand. I think you can all kind of get an idea of how that affects your balance. When you stand on sand, it's not a stable surface, and it becomes more challenging to maintain balance. And then to work on the vestibular piece of it, it's doing head movements, either turning your head, tilting your head, can activate your vestibular system as well. So that is one additional way we like to think about training our balance systems. Some additional interventions, so thinking about bracing. So bracing can help compensate for situations where there are weak muscles. We can also use assistive devices. Assistive devices can increase our sensory input through our hands. So we're getting, if you think about, touching the wall or touching your countertops with your fingers, often you'll feel more stable. And that's just because your brain is getting more information about where you are in space. It's an extra piece of information that comes into your brain. And then we can use assistive devices, like I said, to increase sensory input, but also to increase the base of support. So if you think about the woman standing on the rock with just her one foot, her base of support is very narrow. And if you look at these people walking with their walking sticks, it actually increases their base of support. Now they're basically almost 4 feet wide, or 4, I guess, legs wide if you want, because they have the sticks on either side plus their 2 feet. So the overall base of support is broadened, and now you're keeping that center of mass. It's a little bit easier to keep it within that base. Some environmental considerations. So next slide. Really important things, again, to reduce fall risk is to consider non-skid surfaces. So like I talked about, the ice being a challenge here in the Northeast. And we also, have slippery surfaces like showers where we have soap and water and things like that. So making sure we put something down to make sure there's it reduces the slipperiness. Using grab bars, handrails, again, turning on lights so our vision is working properly, and wearing good footwear. So if balance is a challenge for you, knowing that wearing certain footwear can certainly help. Footwear that has good broad bases on them can be effective. And then specifically from a physical therapy standpoint, when we're thinking about working with patients that have balance deficits, things that we're doing is we're going to assess all of those sensory systems to see how they're working. We're going to assess strength to see, again, how those messages go back out to the body. And then looking at different balance tasks to kind of get an idea of how everything reacts to each other, and overall function, how a person is walking, how they're moving from sitting to standing, lying, all of those different things to understand how their overall systems are working. And then thinking about, how a person's daily activities and their leisure interests kind of impact their balance. So what do they need to be able to do during the day, from a job standpoint, the environment they're working in, their family responsibility, and what the person's goals are. So we need to make sure that we're addressing what the person is coming in to see us with. Are they having difficulty on just slippery surfaces? Or are they having difficulty standing at their kitchen sink? And what do they want to be able to accomplish? So that's just a quick overview of balance for people with, overall balance physiology, as well as some thoughts about balance in individuals with physical, with myotonic dystrophy. So quick, sorry about that. I wanted to do a couple of things to think about, our things that you can maybe start doing a little bit at home. I have to be very careful when we're talking about balance exercises at home, because I don't want somebody to lose their balance, fall, and have an injury. So I wrote out a couple of things here that are probably manageable at home, but of course, do not try anything that you don't feel comfortable with. Again, some balance challenges can be more than others for some people. So for the first one, if you want to get a chair, or if you're sitting in a chair, I'll move my chair back here. We're just going to work on some weight shifts. And again, this helps build strength and coordination in your postural muscles. Again, in this situation, you're moving your center of gravity, which is in a slightly lower position, but you're still moving it, and you're moving it to the edges of your base of support. So you can sit in a chair, feet on the ground, and just work on some weight shifts, right to left. And you can do these at different speeds, because at different speeds, the muscles will have to work differently. But you can imagine you're using core musculature. You're shifting your center of mass over to the edge of your base of support, and then bringing it back, and then to the other side. And then you can shift and do these forward, and then backwards. All right. And again, you're activating certain muscles. Your vestibular system is working, your vision is working. And again, you're working to return that center of mass over your base of support. You also can work on doing, so if those are pretty easy, then you can add a little bit further excursion outside of your base of support with some reaching activities. All right, so out to the side, now you've got a little bit longer lever arm pulling on your body, and then back. And same thing, you can work on this going forward. All right, you can work on twisting and doing it. Okay, so there's lots of different things that you can do just in a sitting position. And the last one is to look at, again, work a little bit more on your core musculature, but by doing some seated leg lifts. So just in your chair here, lifting your leg up and down. Okay, and again, if you're not using your hands, you're relying on your core musculature to keep you upright. Okay, and then just in our last minute here, I just want to also talk a little bit about things you can do in standing. In standing, I always recommend that people do that in the corners of their house. So either where your kitchen counters come together, or the walls of your house come together. And that's because if you lose your balance, you have extra support that won't let you hit the ground. And you can put a chair in front of you, again, just to help with balance at home. In this position, you can just work on standing without any support. And what you'll feel is that ankle strategy working, that little sway at your feet. Okay, and that's really calling in that ankle strategy. And then you can do things in this position, again, to just do a little bit more challenge. You can work on trying to do it with your eyes closed. Okay, and just again, trying to maintain that position. Okay, but it's really, really important to be doing this in a safe environment. Like I said, the last thing we want to do is have an injury at home by doing balance exercises. And that's why we're a little bit limited on, what we can be doing, without supervision of, a physical therapist, a personal trainer, a family member, anyone else that can help give you the support you need. And I think that I spoke really fast, but hopefully got all the information out.
Yes, everyone, please join me in thanking Dr. Eichinger for that amazing overview of balance and a couple good exercises for you all to try at home if you feel comfortable. So thank you, Dr. Eichinger, for that lovely session.